You're all present here for the World Breastfeeding Week. You all can see on the banner also, it is WABA. WABA means World Alliance for Breastfeeding Action. So it is a thing that is giving all the formulations, what has to be done in this 1 week, what are the updates about this breastfeeding, and also what are the importance of this day. So we are going to conduct this week for 1 week from August 1st to August 7th. With the collaboration of 3 departments, community medicine, obs and gynecology and pediatrics, along with the active efforts of NSS unit. So without any delay, I would like to invite the Dean of Narayana Medical College and Hospital, Dr. P. Srinivas Reddy garu, to please come on to the dais. Next, I would like to call upon Dr. R. Vishwakumar garu, the Vice Principal, to please come on to the dais. Next, I would like to call upon Dr. Vanaja ma'am to please come on to the dais. Next, I would like to call upon the nursing superintendent Manima Igalai ma'am to please come on to the dais. Next, I would like to call upon Dr. Jyoti Kanjivaram ma'am, the HOD of Department of Community Medicine, to please come on to the dais. Next, I would like to call upon Dr. Chandrasekhar Naidu, sir, the HOD of Department of Pediatrics, to please come on to the dais. Thank you everyone for your cooperation, and thank you interns for your coordination. For everyone present here, the first emotion we all feel is the mother. So today is World Breastfeeding Week from August 1st to August 7th. So this 1 week, what are we going to do, how it is going to be, and what are the things we are all going to be, is something which will be told in this program also. Before we move forward, I request all the dignitaries present on the dais to please participate in the lamp lighting ceremony. Thank you so much everyone, please be seated. So this 1 week we are going to have the program. What we are going to do in this 1 week, how are we going to do? There is so many competitions going to be held for all the students and also the interns and also the other departments also. So before that, I would request the Dean of Narayana Medical College and Hospital, Dr. P. Srinivas Reddy garu, to address the gathering about the importance of World's Breastfeeding Week.
All the dignitaries and the dais and off the dais, and also the my dear students and nursing staff of Narayana Medical College and interns and my dear students. And thank you very much for participating in this wonderful program. So you all know that the breastfeeding is the greatest nature's gift to the humanity. Actually, this breastfeeding is not the food to the baby, and this breastfeeding is the vaccine, and this is the medicine, and also everything to the baby. So never think that the breast milk is only food for the baby. In the hands of the mother, the baby always feel the very emotional and also very secured. And so never think that they are feeding should not feel that they are feeding the baby, but they are giving the unconditional love to the baby. So this one should not forget. So don't think that this breastfeeding is, of course we can feed through the bottle also the same milk, but if the mother gives the milk by keeping the baby in her lap, and this always gives highly secured environment to the baby, and also it gives the emotional bonding between the baby and the mother. So this is what always we have to remember. And this breastfeeding, of course, reduces many infections in the baby. And not only that, it can give the immunity to the baby, and it gives all kinds of required elements to the baby which may not be provided through the bottle feeding. And you all know that bottle feeding may cause for lactose intolerance sometimes, and also sometimes it may cause for the infections And sometimes this bottle feeding also causes for the severe oral thrush. Of course, there's fungal infection. So bad bottle feeding is not at all good. But unfortunately nowadays what is happening is, of course, the mothers and also their mothers are saying to them that don't feed the baby, and that may curb your beauty and it may spoil your the body. So these are the this kind of feeding will be given to the mother. That's why most of the young mothers are not much interested to feed their babies. So the first we have to aware their mothers, the bottom in breastfeeding mothers also have to be aware of this particular thing. Of course, always the grandparents used to say that it's a better to give the breastfeeding. In this way, not only the mother who is feeding their baby and also the family members always have to support to do that breastfeeding. It's not a simple thing. It's of course, it's almost like a divine thing. And never forget to aware your patient once the mother comes to the postnatal life. So always this is we have to enlighten the importance of breastfeeding. So this breastfeeding week we are celebrating, and in this particular inaugural program we have to have this idea and we have to propagate this idea in the community. Of course, being a medical students and also the nursing faculty, everybody very well knows about this particular importance of the breastfeeding. But your responsibility through this is we have to make aware of the people in the community to know the importance of breastfeeding. So this is a very most important thing. Don't think that mothers are knowing better. Even then, if you start teaching if you start telling to the so many mothers, at least 5% of the mothers will change their attitude, and then that is enough to change the community, and their mothers also can change the next generation. So with this is sometimes just now I am thinking this is the pity of our human culture nowadays to talk about the breastfeeding. మనకి ఇంతకంటే దరిద్రం ఇంకొకటి లేదు. అంటే బ్రెస్ట్ ఫీడింగ్ గురించి కూడా అమ్మలకి తెలియజేయాల్సిన అవసరం వచ్చింది అంటే, దిస్ ఈస్ అ వెరీ ఇంపార్టెంట్ థింగ్. బ్రెస్ట్ ఫీడింగ్ ఇంపార్టెన్స్ ఏంటి? ఒక బేబీకి మన బాటిల్ ఫీడింగ్ ఎందుకు చేయకూడదు, బర్రెపాలో పోతపాలో పోయకూడదు, మన తల్లిపాలే ఇవ్వాలి అని చెప్పాల్సిన అవసరం లాస్ట్ 20 years నుంచి వచ్చింది. అంతకుముందు లేదు. ఆల్మోస్ట్ బిఫోర్ 20 years and mothers used to feed their babies, and also their mothers, that means the baby's grandparents also used to support. But now the things have been changed. అందుకని మనం ఈ వారోత్సవాలు పెట్టాల్సి, బ్రెస్ట్ ఫీడింగ్ డే ఉండింది ఒకప్పుడు, ఇప్పుడు బ్రెస్ట్ ఫీడింగ్ వారోత్సవాలు, ఇంకో 4 రోజులు పోతే బ్రెస్ట్ ఫీడింగ్ పక్షోత్సవాలు, ఆ తర్వాత నెలోత్సవాలు, ఇవన్నీ సంవత్సరోత్సవాలు కూడా వస్తాయి. అంటే ప్రతిరోజు బ్రెస్ట్ ఫీడింగ్ గురించి మాట్లాడుకుంటూ ఉండాలి. So this is a very pity. This is very pity really, and this is how we are thinking about the breastfeeding. It shows. Of course, some of the medical professionals also doing the same thing. And of course, in the community it's there, but some of the medical professionals, even doctors also not feeding their babies properly. This is what we are observing. But your responsibility with this thing is you have to aware the people about the breastfeeding, its importance. And you have to tell one more important thing also, because of the breastfeeding, not only the baby is getting benefited, even mother also getting benefited. It can avoid the breast abscesses, it can avoid the breast cancers, it can avoid the ovarian cancers. These are all the very important things following the breastfeeding. So these are all the things you have to enlighten to your patients, and you have to enlighten your surrounding community and society, so that we can change we can bring some change in this particular myth that breastfeeding may alter the body nature, or it may cause for so many things in the mother, right? With this, thank you very much for all the departments participating in this. That's Department of Obstetrics and Department of PSM, and also the Department of Pediatrics, which are coordinated by the NSS coordinator Dr. D.M. Karthik. And I appreciate all your efforts and also our PR and marketing team who are really covering the entire program to propagate and to circulate in the community. Thank you very much.
Now I would like to request the Vice Principal of Narayana Medical College, Dr. R. Vishwakumar Garu, to share his views about the breastfeeding.
Respected Dean sir and other dignitaries of the dais and my dear students, as you know, the theme and concept of the breastfeeding, which has been briefed by each of who have attended here, and as our Dean sir has rightly put it, it is really unfortunate when there is a need we feel to really educate the mother to feed her baby by breastfeeding. Actually, these are all natural instincts. Even when the calf is delivered by the cow, nobody teaches it straight away. Naturally, it goes to the udder and then it starts feeding itself. Now we calling ourselves cultured, civilized and educated. Now even to educate ourselves we need things which should happen very naturally. Even listening to the cry of the baby is enough for the mother to eject the milk. Oxytocin hormone, the bonding hormone is released. And the benefits of breastfeeding, it is all well-known facts. It provides all the nutrients, fats and proteins, and particularly the particular phospholipids which are there in the milk, they help a lot to form the bulk of the nervous tissue when the child is growing. The growth and development of the brain in the early years of the child is very, very crucial, for which the raw material is provided with breast milk. So if you go on saying there are innumerable benefits like that, and it is a social responsibility for all of us to keep the mothers informed and then make them sensitized towards this healthy practice. Let us do our bit to spread the message. Thank you for the opportunity.
Now I would like to call upon the HOD of Department of Gynecology, Dr. Prasanna ma'am, to address gathering. And I would also like to ask one small thing, is really wet nursing happening in our hospital?
I want to tell one or two things. The one thing is what we are actually not doing is first golden hour feeding. So in many of the places they used to put the baby on breast when the mother is on the OT table or the delivery table, but we are not doing it. And that is not only important for the mother to reduce the blood loss and to reduce and cause more contraction of the uterus, and also better involution of the uterus, it helps. And one more thing is, the community people have an idea, when the buffalo or cow delivers, they allow the baby immediately, calf or baby, immediately on the milk, which is good for that baby. But why not we are doing that for humans? And none of the people are giving milk in first 3 days, 3-4 days, until the breast is engorged and getting white color. Milk means they think always white color, which is first 3 days milk is very, very important for the sake of the baby in getting better immunity and resistance in their future life. And these two are the important thing. And we are always seeing the cattlers when they are wondering how hygiene they are having. But still we are giving buffalo milk instead of giving the mother's milk. That is the pathetic situation in the community, and everybody, actually it is a responsibility of everyone at all levels to motivate the mother at the antenatal period itself towards breastfeeding, and exclusively breastfeeding for first 6 months, which helps as a natural contraception also. And that part is actually lacking, and many people are coming with even cesarean section or normality. Within 6 months they again conceive and they come. And if they feed actually for 6 months, it also acts as a natural contraception. It prevents the ovulation and the uterus will be well involuted, and it acts as a natural contraception also. And the one more thing is weight. So we are actually, the body is storing 3-4 kgs of extra fat for the sake of breast milk. In each pregnancy, it's adding on the body weight, and later it leads to obesity in the mother, and as well as with the top feeding, obesity in the baby. And we can see at a glance the baby, the appearance itself, we can say whether the baby is on breastfeed or on the top feed. That is the appearance or glow on the baby, which gives us as the baby is what they are feeding. So the goal of this year is actually to promote breast milk for at least 60% to be reached by 2030, and should be continued for at least 1 year and to be continued for 2 years. So, as a medical profession, it is our duty for everyone to promote all the pregnant women from the antenatal period itself to motivating towards the giving breast milk and to continue it at least for exclusive breast milk on first 6 months, which is important. And none of the people are having aware of about the breast milk banks are available in the even in Nellore also it is available. If they have extra milk, they can donate to that bank, or if they have lack of milk, they can give. Especially it is for helpful in sick babies and preterm babies. It is definitely helpful for the babies to have a breast milk. Thank you.
Now I request Mrs. Manimegalai ma'am, the nursing superintendent, to please address the gathering.
Andarkum Namaskaram. Sincere greetings to Dean Sir and other dignitaries on dais and all the staff and the interns and everyone. The nurses play a vital role in encouraging breastfeeding. By promoting and ensuring the breast milk, we build a healthier planet. We have to initiate the breast milk with 60 minutes of birth and to be continued for 6 months without any supplement, and for 2 years with other food. Breast milk is, as Dean Sir told, it contains not only nutrient, it contains medicine, food, vaccine and everything. One drop of breast milk has 1,000 antibodies. Formula doesn't. This breastfeeding week, reach out at least one mother, then the child will bless you for a lifetime. By promoting breastfeeding, we are bandaging the health of an entire generation. Whatever I have prepared already, Dean Sir and we Vice Principal Sir and Prasanna Madam, everybody told. So I don't want to repeat those things. So let us, as a nurses, we have to encourage all the mothers to continue their breastfeed. So as a nurses, we have to encourage breastfeeding. Rather than teaching latching, we have to relieve the fear of the mothers in about the breastfeeding. All the best.
Jyoti Kanjival ma'am, the HOD of Department of SPM, to please address it.
So most of the speakers now just told you everything about breastfeeding and all these things. Few points I want to stress is this: giving awareness or making the mother aware of giving breastfeeding should be done right from the antenatal period. Every time the mother comes for an antenatal checkup, it is must that she has to be counseled about breastfeeding, particularly exclusive breastfeeding, and also family planning also. And one more thing is the importance of colostrum. Most of the mothers, what they complain is, I am not having milk, there is no milk production and all these things. But as the baby suckles, the milk will slowly come with the action of the prolactin and oxytocin. So you have to encourage the mother that you make the baby suckle so that milk will produce by itself. Okay, it may be a problem for maybe a few hours, but as the baby suckles, it will get regularized. And the most important myth most of the elders have is that colostrum is very fatty and it cannot be digested by the very newborn infant. But as Sir has said, it is the first natural vaccine we are giving, and it is a must to feed the baby with the colostrum. And no pre-lacteal feed should not be given. Pre-lacteal feeds should not be given like honey or any other sugar water or also. And many nursing homes, or I don't know, but if mother is complaining that there is no milk production, immediately they are telling go for bottle feed. And as we think, community medicine people, smoking is like suicide and bottle feeding is like homicide. Okay, because you all know, particularly those people who have come to the final year or internship. So what is the most important problem of bottle feeding is gastrointestinal tract infections, because if they are not done properly, and dehydration and infant mortality. Okay, so if there is a compulsion that the baby should be fed with bottle, then they have to be educated about the hygiene also. And then exclusive breastfeeding to 6 months and continue till the mother can give or the baby wishes to up to 2 years or 2.5 years. Thank you very much.
Dr. Chandrasekhar Naidu sir, to please address the gathering.
On dais and off the dais, there are two things which are irreplaceable, that is mother and mother milk. These two are irreplaceable. Already many dignitaries has told about the importance of breast milk. I'll complete my talk in 1 minute. How to get better breast milk? Minimum of 3 liters of water per day, fiber rich and water rich diet. These are the 2 requirements to get a good breast milk. So, thank you.
Request Dr. Vice President to address the gathering.
For every woman to become a mother is considered as a greatest gift by the God, and likewise for every child, breastfeeding is the greatest gift that every mother can give. So not only about the nutrition, it also helps in having a great bond in between the mother and child. So we have a lactation team dedicatedly here to provide education continuously for all the patients, so that they'll know the importance about breastfeeding. Thank you.
So I think all the dignitaries on the dais have gave their talks. So what this 1 week is we are going to do, on Monday we have a program in Urban Health and Training Center where all the ASHA workers will be attending the community health center, where there will be a session once again there. I think the support of all the departments is very good for that. And on Tuesday we have a painting competition. So all the people, the posting students, not only the students from the nursing also, who are all interested, from staff also, are all invited for the competition. And post that we have IEC exhibition. So for this, for the first time we are going to conduct, I request all the people present here, also not present here also, to come forward and share your ideas in that. I request the support of all the departments to give some creative ideas to the students. For example, we can give a activity of breast milk banks, and also we can give what is wet nursing, all those things. I want all the students, posting students, staff, nursing, anyone to please come forward and keep models. It is not charged. You can keep some models in different slots. We will be giving you the slots. Whoever are all interested, and already I think gynec department and pediatrics department have already segregated the students. 8 members from each batch will be there. So if there are 50 students, we have divided already into 8 students. 8 students must be presenting one model on that day, and post that there will be a street play also. So thank you everyone who are all present here for your valuable time. And this has been a wonderful collaboration of all the units. It's been 1 year we have started very actively. This collaboration I think is coming out very, very good, and the name itself is World Alliance for Breastfeeding Week. The name itself is suggesting that we need to collaborate actively for the active output of whatever health education we are going to give. So this event, I request all the students to come much more forward and show you all your ideas. All your ideas will be definitely recognized in this college. That is what we are all doing from so many days. We have the active support of the institution. So I request all the students to come outside still more and show all your talents. Now I request all the dignitaries present on the dais to please be seated off the dais. There is a small skit by the nursing department. So they are going to present they have prepared 2 skits. One they are going to present now.
శ్రేయ ఎక్కడున్నావమ్మా? బిడ్డ ఏడుస్తుంది, పాలు వచ్చి. అమ్మా శ్రేయ ఉన్నావా? బిడ్డ ఏడుస్తుంది, పాలు చూడా. ఒరే రాహుల్, ఎక్కడున్నారా మీరు? త్వరగా రండి, బిడ్డ ఏడుస్తుంది, పాలు రండి. ఓ నాన్న ఏడవకు, అమ్మ వస్తుంది, ఏడవకు. ఏంటమ్మా పిలుస్తున్నావు? ఏడుస్తూ ఉంది, ఎక్కడికి వెళ్ళారా? పాలు బాబు డబ్బా పాలు పట్టిస్తున్నారేంటి?
ఏం చెప్పండి సిస్టర్, ఈ కాలం పిల్లలు అసలు పాలే ఇవ్వడం లేదు. ఏం చేయండి చెప్పండి. రాహుల్, రాహుల్ ఎక్కడరా?
ఏంటమ్మా పిలుస్తూ ఉన్నావు?
సిస్టర్ వచ్చారా? ఎక్కడికి వెళ్ళావు?
అదే సిస్టర్ ఎప్పుడు వచ్చారు? బాగున్నారా?
బాగున్నాను రా. బాగున్నావా?
సిస్టర్ వచ్చు కదా.
ఏంటి రాహుల్, మీ బాబు ఏంటి డబ్బా పాలు పట్టిస్తున్నారు?
ఏం చేయమంటా సిస్టర్, అసలు అమ్మాయి వినట్లేదు. మా అమ్మాయి కూడా ఒకటే గొడవ చేస్తుంది. అమ్మ నువ్వు పొయ్యి మీద బాగా మంచిపో బాగా రియాలు కనిపించి. ఏంటి సిస్టర్ అసలు ఏం చెప్పాలి? అసలు మా బాధలు. ఆఫీస్కి వెళ్ళాలంటే ఆఫీస్ టెన్షన్, ఇక్కడ చూస్తే అమ్మాయి లవ్ మ్యారేజ్ చేస్తున్నాం, మా అమ్మ ఒకటే గోల్ చేస్తున్నాం. అందుకే పెళ్లి చేసుకుని వచ్చాము. నువ్వు ఎందుకు అమ్మాయి అసలు బ్యూటీ పార్లర్ బ్యూటిషియన్ చేస్తుంది, ఒకటే బ్యూటీ పార్లర్ అర్థం పట్టుకొని రావట్లేదు అసలు అని చెప్పి మా అమ్మ చెప్తూనే ఉంటుంది. ఆ అమ్మాయికి ఏమో అదొక గోల్. అసలు ఆ అమ్మాయి గోల్ ఏంటంటే కాంపిటీషన్ లో విన్ అయ్యి నేను మిస్ ఇండియా అవ్వాలనేది అమ్మాయి కాదు. అమ్మాయి ఏం చేయమంటారు సిస్టర్? అసలు మీరు ఎలా తీసుకొచ్చి ఇవ్వండి సిస్టర్ మా అమ్మాయి.
సరే రాహుల్, నేను మాట్లాడతాను నీ వైఫ్.
శ్రేయ, శ్రేయ
ఏంటంటే
చూసారా సిస్టర్ పిల్లలు అంటుంది. శ్రేయ
ఏంటంటే
రా శ్రేయ, మన ఇంటికి సిస్టర్ వచ్చారా?
అమ్మా శ్రేయ, బాగున్నావా? ఏంటి సిస్టర్ ఇలా వచ్చారు? ఏంటి శ్రేయ, మీ బాబుకి 5వ మంత్ నిండుతుంది కదా, నెక్స్ట్ మంత్ వ్యాక్సిన్ ఉంది అని చెప్పడానికి వచ్చాను. అవునా సిస్టర్? ఏంటమ్మా శ్రేయ, మీ బాబుకి డబ్బా పాలు పట్టిస్తున్నారేంటి? నువ్వు పాలు ఇవ్వడం లేదా? లేదు సిస్టర్, నేను మా బిడ్డకు పాలు ఇవ్వడం లేదు. ఎందుకు శ్రేయ, ఎందుకు ఇవ్వడం లేదు నువ్వు పాలు? నేను మిస్ ఇండియా అవ్వాలనుకుంటున్నాను సిస్టర్, నేను పాలు ఇవ్వడం లేదు. నాకు అంతా పోతుంది, అందుకే నేను పాలు ఇవ్వడం లేదు సిస్టర్ మా బిడ్డకి. అమ్మ శ్రేయ, నువ్వు అనుకునేదంతా చాలా తప్పమ్మా. బిడ్డకి పాలు ఇవ్వడం వల్ల తల్లి బిడ్డకి చాలా ఉపయోగాలు ఉన్నాయి శ్రేయ. బిడ్డకి పాలు ఇవ్వడం వల్ల నీ అందం ఇంకా పెరుగుతుందమ్మా. లేదు సిస్టర్, నేను పాలు ఇస్తే నా బాడీ అంతా చేంజ్ అయిపోతుంది, ఫిజికల్ వస్తుంది, చేంజెస్ వస్తాయి. లేదు సిస్టర్, నేను నా బిడ్డకి పాలు ఇవ్వను, నా బాడీ అంతా చేంజ్ అయిపోలేదు ఇవ్వనండి. శ్రేయ, నువ్వు ఇలా అనుకోవద్దు శ్రేయ, బిడ్డకి పాలు ఇవ్వడం నీకు చాలా ఇప్పుడు అవసరం శ్రేయ. నీ బిడ్డ కూడా చాలా ఎదుగుదలకు ఉపయోగపడతాయమ్మా నువ్వు పాలు ఇవ్వడం వల్ల. లేదు సిస్టర్, ఇదంతా కాదు, నేనైతే నా బిడ్డ పాలు ఇవ్వను, నేను మిస్సింగ్ అవ్వాలనుకుంటున్నాను. లేదండి మా శ్రేయ, నేను ఎంత చెప్తే నువ్వు వినట్లేదు కదా. నీకు నేను ఒక వ్యక్తిని పరిచయం చేస్తాను, తనను చూసిన తర్వాత నువ్వు మారుతావమ్మా. వాళ్ళ ఇంటికి మిమ్మల్ని తీసుకెళ్తాను, నాతో పాటు రండి. సరే సిస్టర్, చూద్దాం. వస్తున్నారా ప్రియ? అయ్యో బాబు ఏడుస్తున్నాడు.
అమ్మా అమ్మా ఏందమ్మా వదిన పాలిస్తుంది? వదిన మిస్ ఇండియా కదమ్మా. మిస్ ఇండియా
బాగున్నావా?
బాగున్నాను సిస్టర్, మీరు బాగున్నారు సిస్టర్?
బాగున్నాను సోని. ఇప్పుడు నీకు ఎన్నో మంత్ అమ్మా?
అదే కదా మేడం.
సోని, నీకు 6 నెలల నుంచి ఎలాంటి జాగ్రత్తలు తీసుకోవాలో తెలుసా సోని?
సిస్టర్
6 నెలల దగ్గర నుంచి నువ్వు బిడ్డ కదలికలు గమనించుకోవాలమ్మా. 7వ నెలలో నీకు బిడ్డ కదలికలు బాగా తెలుస్తాయి. అప్పటి నుంచి నీ బరువును కూడా నువ్వు గమనించుకోవాలి. 8వ నెలలోనే నువ్వు ప్రస్తుతానికి సిద్ధం అవ్వాలి. కావాల్సిందంతా రెడీ చేసి పెట్టుకోవాలమ్మా. 9వ నెల నుంచి నీకు రక్తస్రావం కానీ, నీరు కారడం కానీ, మొహం లేదా కాలు వాయడం, తలనొప్పి ఇలాంటివి ఏమైనా వచ్చినా కానీ వెంటనే నువ్వు హాస్పిటల్కి రావాల్సి ఉంది. నీ దగ్గర నా నెంబర్ ఉంది కదా, నాకు ఫోన్ చేయి, నేను వస్తాను మీ ఇంటికి. సరేనా?
సరే సిస్టర్.
శ్రేయ, రాహుల్ మీరు కూడా రండి లోపలికి. శ్రేయ, నీకు ఒక వ్యక్తిని పరిచయం చేస్తా అన్నాను కదా, వాళ్ళ ఇంటికి మిమ్మల్ని తీసుకొచ్చాను.
మీరు రిహానా కదా?
అవునండి, నేనేనండి.
లాస్ట్ ఇయర్ బ్యూటీ కాంటెస్ట్ లో మిస్సింగ్ మీరే కదా? ఏంటి మీరేంటి బిడ్డకు పాలిస్తున్నారు?
తప్పేముందండి పాలు ఇవ్వడంలో?
బిడ్డకు పాలిస్తే అన్నం పోతుంది కదా, మీరేంటి బిడ్డకు పాలిస్తున్నారు?
లేదండి, ఏమీ పోదు. ఎందుకంటే మనం పాలివ్వడంలో మన బిడ్డ ఆరోగ్యానికి చాలా మెరుగుపడుతుంది. అలాగే మన ఆరోగ్య సమస్యలు అనేవి రావు. అలాగే బ్రెస్ట్ క్యాన్సర్ అనేది రాకుండా ఉంటాయి. అలాగే బిడ్డ ప్రేమ మనకు చాలా విధంగా అర్థమవుతుంది. ప్రేమానురాగాలు పెరుగుతూ ఉంటాయి.
అయినా మీరు బిడ్డకు పాలు ఇస్తున్నారు, మరి మీరు ఇంత అందంగా ఎలా మీరు మెయింటైన్ చేస్తున్నారు?
మనకు తగినంత డైట్, ఆరోగ్యానికి మనం తగిన ఆహారం తీసుకుంటే మనకు ఎలాంటి ఆరోగ్య సమస్యలు రావండి. అలాగే మన శరీరం కూడా బాగుంటుంది. అమ్మ శ్రేయ చూసావా, తను కూడా నీలాగా మిస్ ఇండియా అవ్వాలనుకుంది కదా, కానీ తను ఎలా ఉంది, తనను చూసి నువ్వు చాలా నేర్చుకోవాలమ్మా. అందం అంటే పాలివ్వకుండా ఉండడం కాదు, అమ్మతనానికి మించిన అందం లేదు శ్రేయ. నీ అమ్మ కూడా నీలాగా అనుకుంటే మీ అమ్మ కూడా ఇలా అనుకుంటే నువ్వు ఇలా ఉండేదాన్ని అమ్మ. తల్లి బిడ్డకి పాలివ్వడం వల్ల తల్లికి బిడ్డకి చాలా ఉపయోగాలు ఉన్నాయమ్మా. తల్లి పాలివ్వడం వల్ల తల్లికి గర్భాశయం నార్మల్ స్టేజ్కి వెళ్ళడానికి చాలా ఉపయోగపడతాయి తల్లి పాలు ఇవ్వడం. అలాగే నీ బరువును కూడా తగ్గించడానికి తల్లిపాలు చాలా ఉపయోగపడతాయమ్మా. ఇంకా నీ అందాన్ని రెట్టింపు చేస్తాయి. అలాగే బిడ్డకు కూడా తల్లిపాలు, మొదటి వచ్చే తల్లిపాలలో కొలెస్ట్రాల్ ఉంటుందమ్మా. అది బిడ్డకు ఒక టీకాలాగా పనిచేస్తుంది, మేధస్సును పెంచుతుంది. అలాగే బిడ్డకి జలుబు, వాంతులు ఇలాంటివి ఏమీ రాకుండా చూస్తుందమ్మా. ఇప్పుడే నీ ఆలోచనలు మార్చుకొని నీ బిడ్డకు నువ్వు పాలు ఇవ్వాలి, సరేనా శ్రేయ?
సరే సిస్టర్, నా బిడ్డకి నేనే పాలు ఇస్తాను. అయ్యో నా బిడ్డ ఏడుస్తుందే. తెలుసుకోలేకపోయాను నేను. అందం అనుకొని నా బిడ్డకి నేను పాలు ఇవ్వలేదు, ఏదో మిస్సింగ్ అవ్వాలి, పాలు ఇవ్వడం వల్ల నా అన్నం పోతుంది, నా బాడీ పోతుంది అని చెప్పేసి నేను పాలు ఇవ్వలేదు. ఇప్పుడు తెలుసుకున్నాను అత్తయ్య, క్షమించండి నన్ను.
అయినా తెలుసుకోవాలి కదమ్మా, అది చాలా సంతోషంగా ఉంది. ఇలా తీసుకో బిడ్డ. చాలా థ్యాంక్స్ అర్థం చేసుకుని దేవి పాలిస్తున్నాం. ఇక్కడి నుంచి మన ఫ్యామిలీ సంతోషంగా హ్యాపీగా ఉంటుంది, నాకు ఏ టెన్షన్స్ ఉంటుంది కదా. తల్లిపాలు ఇవ్వండి, ఆరోగ్యవంతమైన భవిష్యత్తు నిర్మించండి. తల్లిపాలు ఇవ్వండి, ఆరోగ్యవంతమైన భవిష్యత్తు నిర్మించండి. తల్లిపాలు ఇవ్వండి, ఆరోగ్యవంతమైన భవిష్యత్తు నిర్మించండి. థ్యాంక్ యూ.
Thank you so much. One thing we have told Dr. Vaishnav, why she has called is, in this institution, whatever we are doing, everything we are going to do collectively only and collaboratively. That is going to come out as how you all saw here. This is what is health education. So I want still, Doctor, yesterday as I requested the interns also to do some of the other activity. They told next time we will do. So definitely this week, next week we have a new batch of interns. They are also going to do actively. I request all the students to come forward to do health education as a doctor. Now all the doctors are coming and speaking outside in the wheels, all those things. There is one saying also, the need has come that all the doctors has to come forward and speak. And there is one more thing called AI is not going to replace the doctor. So please come forward and participate in all these programs. We are doing all these programs. If you can see the banner also, for doing the banner, we are working a lot. You can see there one WABA is there. That is World Action for Breast Feeding Week. And also you can see the central government logo, which is an NSS logo, which is representing the central government Ministry of Youth Affairs and Sports. We are also representing the university, and along with that My Bharat. My Bharat is a portal which is a student profile from where like 16 years till 29 years, all the students who are present here or in the India can actively participate in that activities. They will be keeping some quiz, some essay writing. Recently 4 students from the NSS also has participated in a virtual meet with Minister of Youth Affairs and Sports. It is a beautiful access not only for the medical students, for the total student population, and so many departments also can create an activity in that portal. We are all doing so many activities, so many days. That activity we can do it and put it that directly the central government will be able to observe it. So I request everyone to please come forward, and as how you all did today, we are going to do still more activities. I think the support from the institution and also from the staff, students, everything, management will be very good. Thank you everyone for your valuable participation present here.